Hear me? Thank you very much for giving this opportunity. Uh, we are, I'm Dr. Palin and a plastic surgeon by profession and also managing director of Caesar Hospitals. And uh, I think it will be very convenient if I give my little brief profile of our hospital. And in 1985, we started the clinic as a humble beginning, attached to someone's pharmacy in market area, and it was growing. We started with uh, only OPD procedures and minor procedures, and we are the first to start the piles injection, piles ligation, and infrared the infrared coagulation, because a lot of patients were going outside the state for healthcare reason. And after 3 years, we wanted more space and more infrastructure, so we shifted to another rented building. We started with a 9-bedded hospital, and continue to expand. And we the first to start the laparoscopic surgery in the state in '96, and we had this ERCP and the total stone solution, including PSWL. So with all this development and expansion, uh, uh, we we expanded to the second building, third building, and we had all the inconveniences of noise, and we could not keep the generator on the roadside. We could not keep the incinerator on the roadside. People used to complain, and even patients, we didn't have the lift or ramp, so we had to sit down from the OT after fracture repair, and the patient about to fall, and luckily the patient did not fall and had a refracture. That was the inconveniences. So all these inconveniences push us to shift to a location where we can have our own infrastructure designed hospital. So we shifted to the outskirts of Imphal, called Langol, which is very, very eco-friendly. And we had a piece of land, and then we constructed, and gradually with the finance from various banks, we expanded now to 250 bedded super specialty hospital, and we have postgraduate courses in uh, 5 disciplines in plastic surgery. There's the disciplines: plastic surgery, medicine surgery, NSSI. These are the departments, and also we have the nursing college and paramedical institute. And now we have started kidney transplantation, joint replacement, because with the advancement being proximal to the neighboring country like Myanmar, and we target in the last 1.5 decades we targeted medical tourism, and we have developed this kidney transplantation, cornea transplantation, heart, and spine, and interventional radiology, and various other departments. And landmark was 8th of August 2018, when the border crossing was allowed by both the countries, India and Myanmar. And since then till this March of 2020, we have treated more than 2,500 Myanmar patients, and more than 300 we have operated, including brain tumors, 3 open heart surgery, and the kidney transplantation also, one from Mandalay, and others are mainly stones in the gallbladder, stones in the this kidney tract, and these are the happenings. And regarding this Myanmar, uh, uh, 2013, we went there to have a view and to operate free of cost the cleft lip and palate. It was the first Caesar mission Myanmar, and we could operate 103 procedures, and hundreds of them were waiting for us because there is no plastic surgeon in Sagaing. Mongia General Hospital is Mongia is the capital of Sagaing, the neighboring state, and we could operate there with the collaboration from Indian Consul General, Union of Myanmar, and the Caesar Hospital. And second camp, second mission Myanmar was in the month of December, where we did eye camp. We have done 179 cataract surgery.
That is and that is December 2013, Doctor.
Yes, yes, yes.
Okay.
And just imagine, Myanmar has got 6 million population, and only 7 ophthalmologists. And out of that 7 ophthalmologists, only 3 can operate for the cataract. In the population of 6 million, just imagine. Manipur is only 3 million. We have more than 40 ophthalmologists, and half of them can do the cataract surgery. And this is the difference in the healthcare delivery system. And they desperately requested, including the Chief Minister of Sagaing, that they set up this hospital where we can give the service. So this is one area, I think eye care is one area, and we could not operate all the patients, 179 in 3.5 days we have operated. And subsequently in March 2014, we went again here, we went for laparoscopic surgery and cleft lip and palate. Again, I am a plastic surgeon, and I'm the Smile 10 surgeon. Smile 10 is New York-based NGO financing this cleft lip and palate, all free of cost. And the second one, eye care, was sponsored by this Honorable Chief Minister of Manipur that time. And this March 2014, after completion of 32 laparoscopic surgery and another 26 cleft lip and palate, we had the opportunity to meet the Union Minister of Health, because he had come for foundation, laying foundation of the hospital sponsored by India. And with after having a discussion, we agreed to train 2 surgeons and 6 nurses from Myanmar under the Caesar Hospital Overseas Training Program. And also this keyhole surgery was endorsed by the AMASI. AMASI is the biggest laparoscopic surgeon association of minimal aesthetic surgeons of India, in which my brother-in-law, Dr. Jogendra, is that time he was a secretary, treasurer, but now he is the president-elect of this organization. From November, he will be the full-time president of AMASI, and we will be able to do a lot of service in northern India and a neighboring country like Myanmar. They have gone there in Mandalay also recently for this March this year to demonstrate this laparoscopic surgery, advanced laparoscopic surgery. So that is how we have established our footprint in the country of Myanmar, and it came as a national news, and with the word of mouth, people have started pouring in. But there was a lot of restriction from 2014 to 2018 because there was no visa on arrival. There is no permission at the border. Only after this 8th of August 2018, the 2 countries allowed this border crossing. After which there was a tremendous entry of Myanmar to India, because the cost and our cultural similarity has attracted a lot of, I think, the friendship. And just giving example of kidney transplantation we have done. They have already gone to Bangkok for kidney transplantation, and the budget given was 60 lakhs, uh, apart from traveling expenses and a stay. And they could not afford. So ultimately, with some information from their friends, they have come to Imphal, Caesar Hospital, and with everything, it was concluded it was done with 6 lakhs. This is a 10 times difference. 60
Yeah.
lakhs in Bangkok and 6 lakhs in Caesar Hospital.
Yeah.
And it and they have given a very good feedback and a lot of inquiries about kidney transplantation. And also we have received another patient from Bangkok for the spine surgery. We have done this the end of this last year. So that is the I think the amount of I think impact, because Myanmar as such economically not very well to do, and medical advanced medical services available mainly in Yangon, where a lot of other countries have developed their healthcare establishment like Singapore and Bangkok and Japan. And but in Mandalay and especially Sagaing, which is neighboring with northern India, I think they are lacking in the service. So we have several times we have met the honorable chief minister of this Sagaing, and the now consensus is Manipur needs Sagaing and Sagaing needs Manipur, and without this collaboration, I think the India and Myanmar cannot connect. This is one area. Another aspect is the once India is acting is, and a lot of infrastructure development is going on, and the railheads is expected to reach Imphal in the year this 2022, 21, 22, and it is expected to connect up to the border, More, which is 110 kilometer only. And if we once it is connected, and there is a lot of these trilateral highways being developed, so we can expect the even the Thailand periphery of Thailand, this middle class, and Laos, Cambodia, and Vietnam, they are not very well advanced uh, in medical science. So once it is open up, I think if we can, see, it all depends upon our infrastructure development, as you have mentioned in the beginning. We can attract a lot of foreign medical tourists and also medical students. Even from Manipur, we have only 2 medical colleges, and more than 400 students are going outside the state, outside the country for medical studies in private. You can just imagine 700 Manipuri medical students are studying in China, and see the inconveniences recently it is happening. So, and also regarding the northern India, it is surrounded by 4 countries, the Bhutan, China, Myanmar, and Bangladesh. So each state of northern India, they have a unique opportunities. The Tripura has a unique opportunity from Bangladesh, and we have a unique opportunity for this uh, Myanmar. So also Nagaland and Assam. Assam is the capital. It has got a, I think, resourceful and also well connected by air, and already Thailand and Mandalay they have been connected. So in terms of air connection, I think Assam has got an advantage. But for the surface, especially Myanmar and beyond, I think Manipur has the potential, because the number of the medical tourists we have received in the last 2 years, I think it is phenomenal. So this is one area we can harvest by improving the medical infrastructure. So overall, we see with the uh, India's Act East policy, because Honorable Prime Minister has already mentioned that Northern India is the engine of this India, and because uh, this is this reason through which India can connect with the Southeast Asian nations, and the economy will happen in Asia and Southeast Asia in the coming decades, in the century, in this coming century. And we have our own advantage in terms of proximity, in terms of hospitality, English speaking, and also Japan has already proposed for 35 nurses from Northern India, especially from Nagaland, Manipur, and Mizoram, because of the similarity in the face. And we have worked on this with the collaboration with the embassy, Japan embassy. We have already selected 13 nurses from Manipur for TITP, that is a technical interns training program. After 1 year of language and cultural training, they will be working in Japan. We have already started, but unfortunately, because of this virus, Corona, I think there is a standstill. And also, we have already appointed 19 nurses from Sakra Hospital, Bangalore. It is a Toyota funded hospital, and our nurses are working there. And another advantage for this Northern India, especially Nagaland and Manipur, the fierce battle in the Second World War was the Battle of Imphal and the Battle of Kohima, where more than 35,000 Japanese army died, and they remember Imphal and Kohima. Has the emotional connect. And recently, unfortunately, because of agitation here and there, the Honorable Prime Minister and the Honorable Prime Minister of India and Japan plan to come to Manipur and pay their tributes to the departed soul in Fish Memorial in Manipur. But it was cancelled because of agitation. I think time will come when they can visit us. So in their hearts, I think Manipur, Nagaland, and Northeastern India as such, they wanted to help us, and there is a special plan for investment also. I think low-cost fund from Japan, we will be able to develop the infrastructure, the tremendous exponential compensatory infrastructure, so that we can deliver our services for our domestic patients and students. At the same time, we can attract a lot of patients and the students, medical related students from outside the country. This much I would like to give at this moment.
Wonderful, wonderful. Dr. Shah, you are a legend. You are such a genius. I happened to meet you in Manipur, in Imphal. I met you in Guwahati. Wherever you address the various forums, I always found you are so passionate to promote, to develop, and to equip the medical services in the entire Northeast region. Now, ladies and gentlemen, those are watching us from world over on the Facebook Live, Dr. Kundo Bam Palin Sahab. He's a chairman come managing director, consultant plastic surgeon and reconstructive surgeon, and Smile Train partner surgeon. And there is a Shija Hospital and Research Institute located in Imphal. And I've got great regards for him, great respect for him, because he's a person who understands medical. Now, Dr. Shah, I've got few questions and few suggestions from your side to take on, so that the message can go deeper to the government of India also, and to ASEAN countries also, and all of us together. If priority wise we take, first of all, please tell me, priority wise, which are the 5 top inputs required from government of India as far as medical services, medical tourism, and related areas which have to be developed in northeast part of India.
Thank you very much. Northern India as such, I think it is a very resourceful area, region in terms of medical profession. We have very good doctors, and say some of the premier institutes like PGI, in which one of our cardiothoracic surgeon is heading the department of cardiothoracic surgery, Mr. Dr. Sham Kumar. He has already done the cardiac transplant also in PGI Chandigarh.
You're talking about PGI Chandigarh?
Yeah, Manipuri doctor is heading the department of cardiothoracic surgery, and he has already done cardiac transplant, and many others are working.
Could you please repeat his name? Could you please repeat his name?
Dr. Sham Kumar.
Dr. Sham Kumar. So, ladies and gentlemen, yes. Dr. Sham Kumar from Manipur in PGI Chandigarh. Okay.
Yeah, and this is, and also there are so many other areas where Manipuri and notes and doctors are Assam also, and other smaller states also. I think our doctors are doing. So what we need now is the infrastructure to give them the opportunity to manifest their talents. Like, say, when Dr. Sham Kumar comes here or any other place in northern India, he can't operate because there is a lack of infrastructure. So that is one example. So northern India has a tremendous gap in terms of infrastructure. Like for medical college also, out of I think more than around 500 medical colleges in India, but northern India has got only 3%. And in terms of medical seats, all India seats, only 2% medical seats are available for the northern India. So super specialty hospital and other things. So we need the fund for this in developing the infrastructure, the super specialty hospital, the transplant surgery institute, and medical college, dental college training. See, we need to develop large, very good infrastructure for producing a large number of nurses. As I already mentioned, that Japan and Singapore, they are needing thousands of nurses from northern India. And Manipur, as such, we are producing the highest number of nurses next to Kerala, and many of them are working in metros. I think recently, because of this,
Doctor, we got to try your internet other one. So, ladies and gentlemen, connectivity is also one of the issue which we have to take care of. Such a beautiful region, beautiful 8 states, Ashta Lakshmi as far as Honorable Prime Minister of India is concerned. So what Northeast needs is a better connectivity also. Dr. Palin was addressing all of us. So we need a seamless connectivity also going to Northeast part of India. And then only we can get the yeah, please go ahead, Doctor. Please go ahead. Please go ahead.
Yeah, as mentioned, connectivity is I think it is we are trying to develop the connectivity.
Yes, yes.
And
the last point which you took, Doctor, we need nurses in Japan and Singapore from northeast part of India, from Manipur. That was the last point. Doctor, audio is not coming. Doctor, audio. Doctor, audio.
Sorry. Yes. Can you hear me?
Yes, 200%. 200%.
Okay. Yeah.
Please go ahead. Yes.
So
the last point you gave was that our nurses required in Japan and Singapore.
In terms of thousands, and Manipur is producing the largest number of nurses in the country, India, and most of them, I think 30 to 40% of the nurses in the metro hospitals, the super specialty hospitals, are from Manipur. And there was I think uh, when they come back, recently there was some issue in Calcutta also. When they resigned, I think the hospital could not function properly. That is, what I wanted to mention is our nurses are participating in the healthcare of the country, and I think there is a still requirement of thousands of nurses. So we need to develop the very good multiple institutes, so that we can produce doctors, nurses, paramedics, healthcare managers, and so many other. So that and because of the demand, I think Manipur and Northern India can supply the requirement of the country, and also the Southeast Asia already in demand. So this is one. Another is the connectivity you have mentioned. We see development comes on the road only, and the flight, and not only that, we have to have a digital connection also. So it is being connected gradually, and hopefully in another, I think, 4 or 5 years, Northern India, all the states will be connected to train, and various others aerial connection, and like this Mandalay, and the Sagang, and Yangon, and these will be connected. Once it is connected, I think they can easily access. We can also go there. They can come here. This is one area. And third thing I would like to mention about the law and order. India needs to address the issue of law and order in Northern India, and it is being, I think, managed, but we need to end the problems, because it is lingering for quite long time, and this has hampered the development, and also it is giving us a lot of fear psychosis and other things. So this is one area, and another thing is we need to develop this overall, because we cannot grow in healthcare only. So overall development of the region, and also the education is very important, and that needs to be addressed, and also how to connect with the Southeast Asian nations. This is the area where, because when we travel to this Mongya General Hospital, Myanmar, somehow we are already connected, maybe because of our diet or similarity in the face, because we feel homely in in the country of Myanmar, rather than in Delhi. I should be very frank. So,
Okay.
so this
And that is a food
this
part and cuisine, yes.
yeah. Somehow we are already connected, and emotionally, and the culturally, and this is these are a few things. I think once we understand the potential of growth in this area, not only say health is another component. There are so many other sectors, industries, and tourism, and all those things. These are the areas I think we need to address, and the North India should not feel isolated, as it is gradually. Of course, it is gradually being removed. I think these are some of the areas I think we can work together, and within no time, I think uh, we can grow. We can grow very definitely, and maybe after this corona, we don't know when it will end, but even during this corona, we
There
can
are some new
work together.
opportunities. There are some
Yeah,
new
new opportunity.
opportunities during Corona also
Yes.
there are some new opportunities.
Yeah,
Doc,
lot of opportunities. Lot of opportunities.
Dr. Saab, health and wellness is required rather deeper, more in this Corona, in pandemic and all that. what message would you like to give to all the youth of the northeast part of India and connecting with the ASEAN? Because if children get connected, if education get connected, if medical services gets connected, if digitally we get connected, so there can be a lot of synergy. And you rightly mentioned that emotionally you feel at home when you are in Myanmar, and you feel very comfortable when you are there. What message would you like to give to younger generation? Because India has got a very young population, and these youth have got a great future. And if we have to bring good law, order, peace, prosperity, infrastructure, education, medical, health, wellness, everything is connected with youth. What
Mm.
message would you like to give to the youth of entire India, Northeast, and ASEAN together?
Yeah, thank you. I'm allopathic doctor, and if I say something like metaphysics or spirituality, people may think I mean differently, but I have got a strong conviction that our thought has got an effect in ourselves, and also it is gradually proved that there is something like epigenetics. Our genes are change all because of the environment and all because of our thoughts. So we can do a lot of I think development through our thought process. uh, Thought is responsible for thought stress is responsible for diseases, and stress is coming from the thought, and there are thousands of thoughts every day, and these thoughts may be negative or positive. We don't know, we are not aware of our own thought, what we are thinking, how we are feeling, because our feeling is very much related with our thought. So we need to understand, we need to sometimes sit back, and at least 15 to 20 minutes, our youth, what I wanted to convey, we need to sit down, take a deep breath up and down, and concentrate on the respiration. And that is the time our thoughts are reduced, number of thoughts are reduced. This is called meditation. Meditation is the reduction of thoughts, and when the number is very less, we can choose the right thought and inculcate. And that is how we can manage our thought. I'm responsible to choose my thought. I'm the only person to choose my thought. So each of us should be responsible to choose our thought. That is the time when we will not blame others. And that is how we can become healthy, because when we have a negative thought, we are in stress. When we are in stress, all the cells are disorganized. Our immune system is down, and everything is. I think there is a lot of chemical changes. Our body is the pharmaceutical company. More than 1,000 chemicals are being produced in our body, and this can be utilized to produce the happiness peptides. We can we are using stress to make diseases. At the same time, we can use these products, these thoughts, to the wellness of our cells and our body and longevity. So ultimately, our thought can be utilized for making us well, and because this is possible in both ways, both are right, because body doesn't know whether you are thinking right or left, but they will respond. So it is our responsibility to choose our thought, and make our body healthy, and even change the gene. This is already proved. And I would like to give the last message that uh, our feeling is from the thought. By choosing the different types of thought, we can change the feeling, and our feeling has got a direct impact on our brain, and they will release a lot of chemicals. And in terms of this brain chemicals, our body also will uh, uh, act accordingly. So our cells are waiting for your command. whether it is bad or good, and they are going to respond. So it is better to use our thought to make us healthy and wellness and live longer and live, I think, youthful. That is the message I would like to give. We need such type of wellness centers in every part of the country and rejuvenate our thought. And now Corona has given this message. We should not be very greedy. We should not stress ourselves. And this is time. I think art is rejuvenating, and we are given that opportunity to sit back and think and take care of ourselves, take care of our family, and all those things. So Corona, we should be very grateful to Corona, and and
You
and
are
medical science also is changing, and we thought we cannot change. Now we are changing. We are changing every moment. Thank you very much.
What a wonderful message you have given to entire universe, that make positive thoughts, remain positive, think positive. And what a beautiful, I have taken some sentences. You have used our body is a pharmaceutical company. Our cells are waiting for our command, and our thoughts, they affect our cells, and thoughts are responsible for stress. Meditation is the process to reduce my thoughts. Ladies and gentlemen, here is an allopathic doctor, and who gives this kind of a sermon to entire world? All the youth. Let's be positive, remain positive, think positive, talk positive, walk positive, dream positive, eat positive, and that's the way we can nourish and we can develop the entire Northeast, entire India, and we can move ahead with the entire ASEAN, and of course rest of the globe, the entire world. I'm so grateful to you. And Dr. Let me just try it out, because finally, I would just like to try it out to pronounce your name. And if I do not pronounce it properly, my apologies would be there for that. Ladies and gentlemen, here is a very esteemed surgeon. I've got a great regards for him. Whenever I met him, I always got positivity from him. And he always wants to give something to universe. And today he shared so much. He gave an example of the Manipur doctor leading team over here in the PGI Chandigarh in India also. And it is none else than Dr. Pungdongbom Palin ji from Manipur, from Shija Hospital and Research Institute. Dr. Saab, our best wishes to you, our best wishes to your teachers and your students, our best wishes to your staff, and we pray to Almighty that we keep getting more people of your thought process, your positivity, your energy, and bringing this energy in global peace in the whole world. I'm so grateful to you. Thank you, Dr.
Thank you very much.
Joining us this
You
morning.
have, yeah, you have pronounced my surname also correctly. Thank you very much.
Thank you, Dr. Thank you. I'm so grateful to you. Thank you, Dr. Thank you.
Thank you.
Head and regards to everybody, and stay safe, stay healthy. That is the message we are also giving it to you and to everybody in Manipur, everybody in Northeast, and everybody over there. And with that, ladies and gentlemen, thanks for joining us so early in the morning, because Dr. Palin Saab is now going. He's going to help the humanity because a lot of patients are waiting over. Thank you.